All right, so good morning everyone. My name is Debbie Cooper and thank you for joining us for today's presentation. Like I said, my name is Debbie Cooper and I'm an exercise physiologist at HFRC here. I supervise the cardiac and diabetes care program, but I also have a really strong interest in cancer and exercise and have been fortunate to work in this area at various times throughout my career. So today we're going to be chatting about exercise medicine in the treatment of cancer. So let's see if I can get this to work. So did you know that every 4 minutes an Australian is diagnosed with cancer? Cancer has a major impact on people's lives, both physically and mentally, as well as affecting family, work and social life. Cancer is a really diverse group of diseases in which some of the body's cells become abnormal and begin to multiply out of control. These abnormal cells can then invade and damage the tissue around them and spread to other parts of the body. And it does this via the blood and lymph systems, and resulting in further damage and potentially death. So this is just a bit of a graph here to show you how our cells develop. So normal cells grow and multiply in a nice controlled way. Sometimes these cells become really abnormal and very disorganized with variations in size and shape. These cells continue to divide, however, with really poorly defined boundaries. These abnormal cells can form a mass, which is commonly known as a tumour. So whilst not all risks are known in the causation of cancer, the most common agents shown to trigger mistakes in the cell blueprint are chemical, physical and biological. These agents are known as carcinogens and include tobacco, ultraviolet radiation and asbestos. Quite a few cancers share similar risk factors, with 1 in 9 cancers and 1 in 5 cancer deaths related to smoking. We also see 2.8% related to alcohol consumption. There are some other factors that cause cancer, and these include dietary influences, exposure to radiation or infectious agents, or you may just have inherited a faulty gene. What is important to note is that cancer is not considered to be caused by injury or stress. So in 2020, there was an estimated number of cancer cases in Australia, and they predicted 145,483 cases, with almost 77,000 of these males and almost 69,000 of these females. The estimated number of deaths in the same year was just over 48,000, with almost 27,000 of these being males and just over 21,000 being females. So 1 out of every 2 people will be diagnosed with cancer by the age of 85. So whilst this number of people dying from cancer each year is still high, which is mainly put down to population growth and ageing, the death rate has actually fallen by more than 24% compared to recent years. In the 1980s, the cancer survival rate was less than 50%, whereas today almost 7 in 10 Australians will survive for at least 5 years after a cancer diagnosis. And in some cancers, the survival rate is as high as 90%. This has been put down to our good screening and the being encouraged to have regular exams. And we know that the earlier the disease is detected, the better the cancer survival rate. So these are tests like the PSA for prostate or mammograms for breast cancer. So what is the leading cause of death? And where does cancer feature in that? So some of the research I read indicated that cancer was the leading cause of death, whereas working in a cardiac domain, I know that cardiovascular disease is considered to be the leading cause of death. So I come across this slide here, and this is for the Australian Institute of Health and Welfare, so the Australian government. And this information here was based on 2017 and 2019 data. So what I like about this slide is that it breaks down the 5 leading causes of death per age group. So you'll see here in the under 1, cancer doesn't feature, whereas in the 1 to 14, brain cancer is the 3rd leading cause of death. In the 15 to 24-year-olds, cancer doesn't appear again. However, there's some pretty other tragic causes for death. In the 25 to 44-year-old, colorectal cancer comes in at 5th. The research and feeling behind this is that in this age bracket, we're seeing a higher level of obesity, more or a lack of physical activity, and some poor dietary choices. In the 45 to 64-year-old, we see lung cancer second, but we also see colorectal fourth and breast cancer fifth. In the 65 to 75-year-old, cancer is the leading cause of death, and that's lung cancer, but we also see colorectal coming in at the fourth leading cause of death. 75 to 84-year-olds, lung cancer appears fourth. And in the over 85s, even though I've just said that 1 in 2 people will be diagnosed with cancer over the age of 85, cancer is not in the top 5 causes for mortality. So the most common cancers in Australia, and this excludes your non-melanoma skin cancers like your basal cell cancers, but the most common are prostate, breast, colorectal, which includes bowel, melanoma and lung cancer. And these 5 cancers account for about 60% of all cancers diagnosed in Australia. Now this figure here, this graph here probably won't come as any surprise given the slide a few slides ago. But yes, lung cancer is the leading cause of mortality in Australia, closely followed by colorectal, then pancreatic, prostate and breast. And this was the estimated most common causes of cancer in 2020. So the treatment depends on the type and stage of cancer, and the most common treatments around are surgery, chemotherapy, radiation therapy, hormone therapy, immunotherapy or targeted therapies. And you may have one of these, you may have 2, 3, 4, you may have a combination of all of these. So the main goal of treatment is to cure the disease, but if cure is not possible, different treatments may be used to control the cancer. There are new ways of treating cancer always being developed and tested, and in the future we can expect to see a new range of designer drugs that block the blood supply that tumours need to grow. They can also correct the genetic defects that lead to cancer and assist the body's immune system to fight cancer. So these are particularly in your immunotherapy and your targeted therapy cancer treatments. Unfortunately, with these treatments come side effects, and they do impact on all the major systems of the body. So cardiovascularly, we know that we can see cardiac damage, and a lot of that comes from chemotherapy drugs. You might have a breast cancer lady who has been given chemo. She's cured of breast cancer, but unfortunately she's been left with heart disease or cardiomyopathy. We also see an increased risk of cardiovascular disease, and this is often through the side effects of your hormone therapy, your androgen deprivation therapy. We see decreased bone health, weight gain or weight loss and muscle loss. People are experiencing nausea, diarrhea, or just a change to their gastrointestinal function. Impaired immune function is quite common. We see a development or worsening of metabolic syndrome. And metabolic syndrome is a cluster of conditions that increases the risk of developing diabetes, stroke, or cardiovascular disease. So these could be things like a larger waistline, hypertension, or high cholesterol. They all contribute to metabolic syndrome. We see a lot of peripheral neuropathy. And this is where we see weakness or numbness or pain from nerve damage, and it's usually in the hands or the feet, and it can be quite have a huge impact on the patient. We also see cognitive changes, so chemo brain is real. We can see lots of skin changes, so certainly burns through radiation. If you've had a lot of radiation treatment on one site, you can end up with some very nasty burns. Fatigue, we're going to talk a lot about cancer-related fatigue because it has a big impact. Lymphedema is another one that we'll see. And lymphedema is where we have swelling in part of the body. So it could be in the arms or the legs, but we often see it in the trunk as well. And this is because there's the lymph nodes have been removed or damaged, causing lymph fluid to build up in the tissues under the skin. And also we could be just seeing some pain. So if you're being diagnosed with cancer or you're living with someone who's been diagnosed with cancer, none of this information that I've just provided is probably new to you. So how can we help? Well, extensive clinical research has recognised that lifestyle factors such as exercise play an important role in improving the physical and psychological effects of cancer and result in less severe side effects from its treatment. Evidence has also been shown to be safe and effective and one of the best medicines people with cancer can take in addition to their cancer treatments. So I've talked about physical activity and I've talked about exercise. So what is the difference? So physical activity is defined as any movement that is carried out by the muscles that requires energy. In other words, anytime you move about, you are being physically active. So every time you get up, get out of a chair, do the housework, go shopping, you are being physically active. Whereas exercise is a planned, structured, repetitive and purposeful movement intended to improve or maintain physical function or physical fitness. So this is where you might take a gym class, an aerobics class, water aerobics, you might play tennis. This is structured exercise. So there's lots of research being done on these benefits, and this slide here is from a company called XMed Cancer, and they're from the eastern states, and they were initially funded through the Victorian government. But they do a lot of research in this area, and they're certainly in research involving people with cancer. And what their research has shown is that exercising regularly, and that is the key, can improve your health and well-being, improve your state of mind and relieve stress, reduce the severity of anxiety and depression, improve your social function, increase your energy levels and reduce fatigue, improve your heart function and reduce the risk of heart disease, diabetes, osteoporosis, and other forms of cancer. They can improve lung function, improve strength and build your muscle, and strengthen your bones and function of your joints, help maintain your physical function and make everyday activities easier to do, and improve your balance and reduce the risks of falls, which is very important. And all of this combined helps to improve your quality of life. So to reinforce that, we know that physical activity and or exercise can increase enjoyment, increase your aerobic capacity, aid recovery from treatment, increase lean muscle mass and strength, improve your quality of life, and reduce fatigue. So exercise is widely accepted as important for maintaining good health, reducing the risk of chronic disease, and aiding rehabilitation from disease. We have some further benefits, and there's some emerging research also suggests that exercise may help lower the relative risk of cancer reoccurrence and cancer-related death for people diagnosed with some cancers. And most of the research at this stage has been done with breast, colorectal and prostate cancer patients. We also know that with exercise, we can improve the chemotherapy completion rates, which is really good, reduce hospitalisation duration, which helps with that ongoing deconditioning, and reduce number and severity of symptoms and side effects, like we talked about pain, fatigue and nausea. So this is all great. Excellent, lovely benefits from being involved with cancer when you have exercise when you have cancer. However, only 1 in 5 people diagnosed with cancer are actually meeting the National Physical Activity Guidelines, with physical activity levels not returning to pre-diagnosis levels post-treatment. And unfortunately, this finding is consistent across all cancer survivors. So what are the physical activity and sedentary behaviour guidelines? These seem quite intimidating. The real take-home point is this first paragraph, and doing any physical activity is better than doing none. If you currently do no physical activity, start by doing some and gradually build up to the recommended amount. We want you to be active on most, preferably all days, every day of the week. Accumulate between 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity, or an equivalent of a combination of both each week. Do muscle strengthening activities on at least 2 days a week, and minimise the amount of time spent in prolonged sitting. And if you are sitting, try and break up those long periods of sitting as often as possible. So what are the barriers? We know that 4 out of 5 people with cancer are not exercising. So these are some of the things that have been listed. The cost. We know that cancer treatment can be very expensive for some people. People may not be able to work whilst they're receiving their cancer treatment. So then to be expected to pay more money for exercise can sometimes just be too much. If you have nausea or feeling unwell, it's going to be very difficult to exercise. You might have no interest, and I know a lot of people who don't have no interest in exercise, or you might don't have a friend to exercise with. And motivation can be have a huge impact on whether you exercise or not. And I love to exercise, but sometimes I don't have the motivation. So having a friend to go with really helps with that, really gives you that, that goal to go and exercise. You could have some other health conditions that you feel exclude you from being able to exercise. There's that fatigue again. You could just feel really tired. You could have an injury such as muscular or joint problems or fear of an injury, and it's something that you just can't deal with at this time. You could still be experiencing some pain. There's also an age-related decline in physical activity. We know that. You could have a lack of knowledge, just not knowing what to do, time or confidence. So we've talked about fatigue a few times, and the fatigue that we're talking about is cancer-related fatigue. And the reason that it is mentioned is because 70 to 100% of patients treated for cancer are affected with cancer-related fatigue. So CRF is reported as being very distressing and disruptive to daily activities, often more so than pain. And CRF can lead to significant reductions in physical function and quality of life. So the National Comprehensive Cancer Network have defined CRF as a persistent, subjective sense of tiredness related to cancer or cancer treatment that interferes with usual functioning. It's also been characterised as severe and distressing, persistent, so it's ongoing, not consistently alleviated by sleep or rest. So you may have had the best night's sleep, but you're really struggling to get out of bed in the morning. It's not in proportion to the recent activity that you're trying to do. So you might be trying to wash the dishes, but it feels like you're trying to run a marathon. And it interferes with your daily activities and social functioning. So some suggested causes, it is believed to be multifactorial in origin. So that means that it has a physiological and psychological origin. And these, some of the things suggested could be anemia, could be a systemic reaction to tissue injury caused by disease, could have infections, or just that sleep disturbance. Some other contributing factors include chemotherapy, and there's emerging evidence supporting the extremely detrimental impact chemotherapy has on health-related fitness, which results in an increased fatigue and a decrease in quality of life. We also see muscle wasting, so the decrease in physical activity, decrease in food intake, imbalances in the rate of muscle protein synthesis and degradation all result in muscle wasting, which results in increase in cancer-related fatigue. Okay, sorry. So then and now, so we know that, oh my gosh, in the past, traditional cancer treatment consisted of rest and avoidance of physically challenging activities. There is now a big shift in this thought, thank goodness, with exercise now an integral component in cancer rehabilitation. Whilst this may sound counterintuitive, exercise really does reduce cancer-related fatigue. People may experience fatigue at any time from diagnosis through to treatment, and some even experience it many months after treatment. Fatigue can vary from day to day and from week to week, with activity levels needing to be adjusted to compensate for this variance. I would used to say with my patients or clients that to keep a diary or a journal and jot down when they felt the fatigue at its worst. And then we could try and work around those times and exercise at times when that was perhaps a bit less. And we could build those times up and hopefully reduce down the cancer-related fatigue times. So aerobic exercise results in improved functional mobility, muscular endurance, and increased aerobic capacity. So this is our VO2, and this all helps to decrease cancer-related fatigue. So our VO2 is the maximum rate of oxygen the body can use during incremental intense exercise. So the more we can improve that, the more that we can do. Resistance exercise can prevent muscle wasting, improve muscle strength and endurance, reduce skeletal muscle metabolism, so the breakdown of the muscle, and increase size of muscle fibers. And this all helps to decrease cancer-related fatigue. So what are the exercise guidelines for people with cancer? So the American College of Sports Medicine put out these guidelines a little while ago, and what they did was they broke down the purpose of why you would be exercising. So we know that low intensity, the activity is really to maintain function or prevent deconditioning. So you'd be looking at 3 to 5 minutes of activity that is well tolerated, several times per day, maybe at or below 50% of heart rate max, and you want to gradually increase exercise time and intensity. So things like Tai Chi, slow walking or swimming or yoga really fit into this umbrella here. We could then move into moderate intensity exercise where we're looking to exercise to promote health. And this is where we start to accumulate 30 minutes most days per week. Training between 50 to 70% of heart rate max with an RPE of 11 to 13. Now, what's an RPE? So this is our rating of perceived exertion. So it's a chart that we use to basically ask you how hard you felt that activity that you had just completed. And it says, we call it a Borg scale, and it's a 6 through to 20. So 6 is equal to when you're sitting down, having a cup of tea, resting, you're not exerting any effort. And 20 is down where it's maximal effort. And I've had some cheeky clients change that to cardiac arrest. So we certainly don't want you working down that area. But 11 to 13 is about that somewhat hard. So you would still be able to talk comfortably. You can sing if you want to, but you're starting to feel a little bit sweaty and you can feel your heart rate increasing slightly. And the activities that come under this umbrella are fast walking or fast swimming, water aerobics, dancing, cycling or gardening. So then we move into the high intensity where we're training to promote fitness. And we're looking at doing this to 30 to 45 minutes, 3 to 5 days a week. Now we're getting up to that 70 to 90% of heart rate max. And our rating of perceived exertion is now 14 to 16. So this is where it's becoming hard or very hard. Now that's something to work towards. We wouldn't be expecting you to be in that. And just jumping back to that moderate intensity, it says to accumulate 30 minutes. So yes, we're saying 150 minutes a week, which works out to be about 30 minutes. But you don't have to do that in one. That can be very intimidating for someone who's just going through all this treatment. So breaking it down to doing 3 sets of 10 minutes a day is equally as effective as doing 30 minutes in any one time slot. So perhaps 10 minutes walk after breakfast in the morning, 10 minutes after lunch, and then another 10 minutes before dinner will really help, and you can build that up over time. Oh, sorry, and I didn't include that one. So fast cycling, brisk hill walking, jogging, running, aerobics, or most competitive sports come under that high intensity umbrella. So this slide here is very busy, so don't try to take everything in here, but it's this study was the effects of exercise on health-related outcomes in those with cancer. And it was done through the Exercise Medicine and the American College of Sports Medicine, and these are their guidelines. So a couple of things I just wanted to point out there was that what can exercise do? So we know that by meeting these guidelines that we talked about, that 150 to 300 minutes, we can help prevent 7 of the more common cancers, and things like bladder, breast, colon, endometrial, esophageal, kidney and stomach cancers. We can also help in the survival of 3 of the common cancers, and that's breast, colon and prostate. Now the exact dose is not exactly known, but they feel that the more activity appears to lead to better risk reduction. We've also got our cancer-related fatigue, health quality of life and physical function here. So there is some evidence against aerobic only and resistance only, but there's more evidence in a combination of doing aerobic and resistance. And we're again looking at that 2 to 3 times of 20 to 40 minutes of exercise aerobically, and then that 2 times of resistance training. And you're looking at 2 sets of between 8 to 15. With anxiety and depression, it's slightly different. So there's insufficient evidence just on resistance only. We've got some good evidence for aerobic only, and that's 3 times a week, up to 60 minutes. But there's also some really good evidence of a combination. Lymphedema is strong evidence behind resistance only for lymphedema, and that's 2 to 3 times a week of those 2 to 3 sets of resistance training. The same for bone health. Insufficient evidence for aerobic only or a combination, but some really supportive evidence in that resistance training activity. So the Clinical Oncology Society of Australia, which is COSA, put out a position statement recently on exercise in cancer care. And their statement stated that all people with cancer should avoid inactivity and return to normal daily activities as soon as possible following a diagnosis. So that is to be as physically active as current abilities and conditions allow. And that's really, really important, is taking into consideration how you are currently feeling and what your treatment stages are. All people with cancer should progress towards, and once achieved, maintain participation in at least that 150 minutes of moderate intensity or 75 minutes of vigorous intensity. And that's those things that we talked about: walking, jogging, cycling or swimming. And make sure that they're including 2 to 3 resistance sessions each week as well. Okay, so they also recommend exercise should be tailored to the individual's ability, noting that specific exercise programming adaptations may be required based on the disease and treatment-related adverse effects, anticipated disease trajectory, and their health status. So it's important to remember that it's not a one-size-fits-all approach. Appropriate exercise prescription for those living with cancer needs to be targeted and individualised by an exercise professional according to the needs of the patient and their particular cancer-specific considerations. Remember that sometimes a seemingly easy activity, for example, that walking for 10 minutes that I talked about, might feel like a moderate intensity or higher during treatment. So it's important to exercise an intensity that feels right. This is particularly important as you move through the different stages of diagnosis, treatment, and recovery. So based on the level of evidence available, leading national and international cancer organisations recommend people with cancer adhere to these evidence-based guidelines. There are some what we call contraindications to exercise. However, it is still possible with any of these conditions, but it needs to be tailored to minimise any risks. And this is where an accredited exercise physiologist who has experience in cancer will be best placed to work with whilst you're living with cancer. And these are the things that perhaps you've just had surgery in the past few weeks. You could have periods of very low immunity depending on when your treatment is, which you could increase your bleeding risk, especially if you have a low platelet blood count. You could be experiencing nausea or having a severe reaction to radiation therapy. And we've seen some really bad burns through ongoing radiation treatment. So it's best to not exercise there. Allow that time for that site to heal so that you can continue your treatment. So COSA, also recommend exercise to be embedded as part of standard practice in cancer care and viewed it as an adjunct therapy that helps counteract the adverse effects of cancer and its treatment. All members of the multidisciplinary cancer team to promote physical activity, discuss the role exercise has in cancer recovery, and recommend people with cancer adhere to exercise guidelines. Best practice cancer care includes referral to an accredited exercise physiologist or a physiotherapist with experience in cancer care. So what is the future? So what we are moving towards now is exercise medicine, where a patient is diagnosed, their key issues are determined, then we prescribe the exercise so that they are internally producing a medicine to improve their chances of surviving the cancer. Now, this is exactly how you would be being treated at the moment. You are diagnosed with cancer, your key issues are determined, and then you are prescribed the treatment process that you're going to take. And that, what we're saying here is that exercise will be part of that journey as well. So quite a few years ago now, Catalyst ran a story, Catalyst on ABC, which had some really exciting new evidence and proposed mechanisms where how exercise was helping in the treatment of cancer. And one of the proposed mechanisms was a blood flow. So we know the goal of treatment is to get chemotherapy agents to the tumour site. However, tumours have been known to have a very poor blood supply. So when you're undertaking physical activity, there's an increase in blood flow throughout the body. And whilst you're having chemo, this allows more drug to reach the tumour where it's needed. So exercising immediately before or after treatment can influence the circulation of the blood, allowing more chemotherapy to target the cancer cells, which is really exciting. And there are some places now that have people on exercise bikes whilst they're having their chemotherapy to help with this. The other proposed mechanism was allowing the immune system to do the job. So we always have potential cancer cells in our body. They are always floating around, but the body is an amazing thing, and it works to find and eliminate these cancer cells with things called natural killer cells. And these are the NKCs. So when exercising, our body releases adrenaline, which signals the release of NK cells. And these muscles to release interleukin-6, which is a protein in the body. Interleukin-6 seeks out the tumour cells and directs the natural killer cells to target and eliminate the tumour. So what that means is that exercise is allowing the upregulating of the body's own immune system to generate its own anti-cancer drugs. Okay. So finally, I'd like to ask you a question. If someone offered you a wonder drug that helped you lose weight and keep it off, slash your risk of chronic disease, prevented and treated mental health issues, and extended your lifespan, and could be obtained for free, would you take it? So the good news is this drug already exists, and it's called exercise. So exercise really is medicine, and you need it. It's also linked to significant reductions in the risk of heart disease, type 2 diabetes, some cancers, depression and anxiety, while shielding against cognitive decline and dementia, and improving bone density. So physical activity and exercise are the single most important things to do on a daily basis to improve your health. There's nothing else that gives you all those benefits. Now, if that's not a wonder drug, I don't know what is. So I'm going to leave you with this slide here. So sometimes the solution can be the simplest yet hardest thing to do. However, it yields the best results.